face and neck postoperative care. Apply cold compresses every 1 to 2 hours for 15 minutes at a time for the first 3 days. Switch to warm compress after 3 days. Avoid hot temperatures to avoid burns to the skin. Do not heat gel packs in a microwave, and do not use a heating pad or boiled water. Keep your head elevated above your heart with pillows during your naps and at bedtime until your first postoperative appointment. Maximum facial swelling occurs between day 3 and day 5 after surgery. Asymmetrical swelling is normal, but if one side looks significantly different, please call the office. Take prescribed medications as instructed. Do not take aspirin, Aleve, Advil, or aspirin-containing products. Substitute Tylenol for pain relief if the prescribed narcotic is too strong. If you have a fever greater than 101, experience nausea and vomiting, have extreme pain not relieved by the pain medication, or have other problems related to your surgery, please call the office. If a gauze wrap was applied, remove it 2 days after surgery. This will remain off. Do not remove any surgical tape. The nurse will remove it during your postoperative appointment. Begin suture care 2 days after surgery. Clean the suture lines with a cotton tip applicator soaked in half hydrogen peroxide and half water solution and allowed to dry. Next, apply a thin layer of antibiotic ointment such as bacitracin or polysporin to the suture line. Continue this care twice per day until your first postoperative appointment. Please do not use Neosporin. Keep your lips moist with Vaseline or a lip moisturizer. Soothe dry mouth with throat lozenges or mints. You may shower 2 days after surgery. Keep chin elevated at all times and do not bend your head forward even in the shower. You may wash your hair 3 days after surgery. Wash your hair gently with a baby or hypoallergenic shampoo in a face-up position. You may wash your face with gentle facial soaps. Drink clear liquids and eat soft foods in the first 24 hours after surgery. Use smaller size utensils like baby spoons since mouth movement will be limited for the first few days. Straws for drinking liquids are encouraged. Avoid putting a cell phone or telephone up to your ear while your incisions are healing. Use the speakerphone or swab the phone with alcohol wipes before putting it up to your ear to minimize the risk of infection. Use alcohol wipes to disinfect the arms of eyeglasses and sunglasses before wearing. Do not smoke for at least 4 weeks after surgery and avoid places where people smoke. Avoid wearing makeup until after your first postoperative appointment. Avoid makeup on incisions until advised by physician or nurse. Avoid direct sun exposure for at least 2 months to prevent swelling and hyperpigmentation of the incisions. Avoid lifting over 10 pounds and strenuous activity for 6 weeks. Please call the Winter Park office with any questions or concerns. If it is after business hours, the answering service will forward the messages to our staff.